I also want to thank Lieutenant Governor McKee, who's here, and we're excited about that, as well as Secretary Pryor. I'm looking forward to our discussion today because it's an opportunity for us to get together. We know that there's been a lot of excitement and energy and different things going on, different questions. We want to be able to address them today. By and large, we have some good news stories, so we want that to be a key component that we'll take out of this. Our numbers are coming down, vaccines are going out, and we'll have some updates in terms of restrictions given what we are looking to do. So let's focus on that together and be real about what we're experiencing so that all Rhode Islanders can have a path forward. As always, I'll get us started with the data. As you can see on our dashboard, yesterday we had 496 new cases out of 17,850 tests that were done. That is a percent positivity of 2.8%. Very sadly, we also saw another 11 COVID-19 associated fatalities. Now, we talk about how critical our hospitalization data is. We are seeing good trends in our hospitalization data. We now have fewer than 300 hospitalizations for the first time since early November. Our weekly average is down to 400, a significant improvement from just last week when it was nearly 500. Our percent positive rate has been consistently decreasing for the last several weeks, and our weekly average has been below 5% for the past 2 weeks. This trend in percent positivity is really great news. What's important, however, is for people to keep in mind that we are doing an enormous amount of testing. We continue to lead the country in testing. In the last week, we have run more than 110,000 tests, which is an incredible number and such a credit to the entire team of individuals that work day after day to help make that happen. Thank you. Doing so many tests keeps our percent positivity down. That's the goal. Even though we are still seeing hundreds of new cases per day. So while there's no question that our data look better right now, it's important to recognize that there is still a lot of virus circulating in the community. The key with the extraordinary amount of testing that we're doing is to make sure we are doing everything we can to identify all of those cases of virus circulating, which we are able to do effectively. There are a lot of factors contributing to our improving numbers. Let's talk about them. We took aggressive action with our pause to arrest the steep incline we were on around the holidays. So we saw what was potential to happen. We made an aggressive move to hinder that, and we've been able to successfully ward off from having to go into those significantly high numbers. Also, we have gotten more than 100,000 doses of vaccine into people's arms. And in particular, we have gotten those doses into the arms of some of the most vulnerable Rhode Islanders. That also is instrumental in impacting our hospitalization numbers, as well as what happens with deaths or otherwise. And another key is that we have treatment for COVID-19 for people who are at highest risk. And we met our goal of treatment doses per week and are now increasing that goal even further so that we can continue to distribute it. Another reason why the data are looking promising is that people, Rhode Islanders, are doing a good job practicing social distancing and wearing your masks. I was asked about the flu here last week. We're seeing virtually no flu. We've gone back and checked and assessed overall in Rhode Island right now. And that is evidence that the infection prevention measures you are taking are working, not only for COVID-19, but also for flu and other respiratory viruses. Having said all that, what concerns us right now are the new strains of COVID-19 that are circulating in the world, in the United States, and in our region, in neighboring states, also likely here in Rhode Island as well. Viruses constantly change their mutation, and new variants of a virus are expected to occur over time. Sometimes new variants emerge, and then they disappear. Other times, new variants emerge, and they persist. Many variants of the virus that causes COVID-19 have been seen in the United States. When you read about them in the news, they are usually associated with the place where they were first identified. So, for example, you've probably heard about the UK strain or the strains that were first identified in South Africa or in Brazil. So we have not definitively seen them here yet in Rhode Island, but it's important to know that we have a systematic process in place to monitor for them. And it's even more important to understand those new variants being in our neighboring states, officially identified, and in other places throughout the country, it's only a matter of time before they are here in Rhode Island. And as an infectious disease specialist myself, I can tell you, in conferring with my colleagues, there's concern about this strain and how transmissible it is. These variants seem to spread more easily and more quickly than other variants, which would actually lead to more cases of COVID-19. An increase in the number of cases of COVID-19 would then lead to more hospitalizations due to COVID-19 and potentially more deaths, all of which could increase the strain on our healthcare resources, which is always what we are looking to protect against. So far, studies suggest that the antibodies generated through vaccination with our currently authorized vaccines will provide some protection against these variants. However, this is still being closely studied. While we have every expectation that we will identify these new strains here in Rhode Island, we cannot predict how they will affect our state. All we can do, and what we have been doing, is looking at the data and our models, the projections, what they are potentially saying, and doing what we need to now to protect against that. We want to have the full strategy for what you can do to continue to protect your household against COVID-19, including the new variants that would come in the future. Because we have not identified them directly here in Rhode Island, there's a sense that we may have another month or so before it really begins to pick up. But we want to make sure now that you have the tools needed to prepare. The place to start is with masking. We've said from the beginning, as soon as we understood that, masking is one of the key ways to prevent transmission and to protect yourself and your household. Everyone needs a high-quality mask to prevent the spread of virus and for your own personal protection as well. With a virus that's even more transmissible, it is all the more important to make sure that you have access to the best quality masks that are there. We are working now to bring more high-quality masks into Rhode Island and to get them into your communities. Over the next week, we're going to share more information on what we mean by a high-quality mask. What are some of the things you can do to get access to more masks, to use the masks that you do have even more effectively, or other tools that will be helpful in preventing the spread and combating the increased transmissibility of the new variant. The second focus area will be ventilation. We've known that when you are indoors in poorly ventilated areas, that is one of the recipes for super spreader type events, particularly when that's over an extended period of time. So we're going to be encouraging businesses and public places to continue to work towards improving your air quality. That's going to be a way to help combat what's to come with the new strain. The aim will be to have at least 2 air changes per hour. Again, we'll be back with more specifics on what that means and what steps we can all take to achieve ideal ventilation, knowing that that's going to be a helpful approach. And finally, setting aside where you work and where you live, we're asking people to minimize how long they stay in any public indoor place. Unless you work there or live there, you should avoid being indoors somewhere, particularly where there is poor ventilation, for any longer than 1 hour as a general time frame. That's a tool that you can work with. If you're in a place where the ventilation is poor, and it's a place that you don't have to stay for a prolonged period of time, you're not working there or living there, think about an hour time frame to be able to get in, do the things that you need to do, and then to continue to move on. After I'm done speaking, Secretary Pryor is going to discuss some updates that we're making to our current COVID-19 restrictions for businesses and other venues. These updates are based on the improving data situation that I outlined earlier, and will ultimately include some of this information that we want to support businesses with in terms of improving ventilation and understanding the time constraints and risks when there is a poor ventilation environment. We understand how challenging this year has been for the business community and for everyone throughout Rhode Island. We want to express the importance from a public health perspective of our economic health as well as of our public's health. If the data indicate that it's okay to ease some restrictions in some areas, even if it's just for a temporary period of time because of our concern about the variant in the future, it's something we believe in being able to do because we know the hardships that exist. So in advance of getting into that good news story more, I want to also be candid with people about the fact that because of the new strains, while we might make some improvements in terms of restrictions, they may have to be temporary, because we're moving in the direction in the future of dealing with the new strains that may be coming, and it may require additional restrictions to prevent cases, more hospitalizations, and more deaths. We are again seeing the potential for those increases, and we know what works to be able to stop it from getting overwhelming. So it's possible that in the near future we would have to do something, but because we recognize the hardships and what's in place for right now, with how good we're doing with our numbers, we do want to take advantage of this small window to be able to see what type of restrictions we can ease to support our business community. So Secretary Pryor will come up to share more on that topic.